Hello, everyone. Welcome back to another episode of Brown People Problems, a podcast where your host, I, Nikita, sit down with guests from around the world to really just talk about experiences and issues unique to Brown folks all over the world, but especially in the Western part of the world. Today, we wanted to chat about naturopathic medicine, holistic health, what really is alternative medicine, naturopathic stuff. I think it's definitely been on trend lately and it's flying around quite a bit. And so I decided to call in a good friend, a naturopathic doctor, Dr. Ekum Romana here. She's joining me from BC. She is a naturopathic doctor in BC, Canada. She focuses on women's health with a strong focus on mental health as well as digestive health. And I already love this because you know how much we love to talk about mental health and digestive health on here. Her focus is to help her patients better understand the root causes of their illness, to empower them with advocacy and really take charge of their health. I absolutely love that instead of just into management. So welcome, Ekum, to today's episode.
Hi, Nikita. Thanks for having me. I'm so excited to be here.
Yeah, absolutely. I'm so excited to be connecting with you. This is a topic that I've been thinking about for quite some time. And when I discovered that you had finished school and you were just practicing, I thought, oh, perfect. Ekum would be perfect for this. So I'm so happy that you could join me today.
Oh, well, no, I was super excited to get the invite and watching you and your counseling journey throughout. I've been like super excited to be a part of this conversation.
Thanks. Happy to have you here. So tell us a little bit about, and I have to be honest, like right up front, I don't know a lot about what naturopathic doctors do
Yeah.
exactly. So that's definitely a blind spot that I have actually been looking to sign up with a naturopathic doctor for sure for some time. So I'm sure there's a lot of people listening who also don't understand this field of practice, and they may have a hard time kind of distinguishing what is a naturopath versus what is a naturopathic doctor. So I'm
Yeah.
wondering if you can clarify that for us a little bit.
Yeah. So, you know what? I meant to look up sort of how things work in Toronto before I came into this, and I didn't get a chance to do that. But in BC, at least, naturopathic physicians are general practitioners. So when you say I'm going to go see my GP in BC, that would be your medical doctor or your MD, or your naturopathic doctor, which is your ND. So, technically, we take on the role of a family doctor, although people don't necessarily associate naturopathic medicine as, I'll still have patients coming in saying, oh, but I talked to my family doctor. And I'm like, I'm also your family doctor.
Mm.
And I think that's just due to the difference. In Canada, we're used to the free healthcare. A lot of naturopathic medicine is out of pocket.
Mm.
So we don't associate that as sort of our typical, family doctor experience here. That's considered sort of specialty care a little bit. But yeah, so I actually have some like information because I think this is important to convey. A lot of people, when they think naturopathic doctor, they think, oh, they're kind of like into herbs. They sort of like natural remedy, and that's sort of the scope. And a lot of times people are surprised by how much we can do. So, licensed naturopathic doctors that also have their pharmaceutical license can prescribe all of the medications.
Mm.
Just a few limitations there, but not extensive by any means. So any antibiotics or steroids or all of those things we can prescribe. And we kind of have 6 modalities, counseling being one of them. So that's
Interesting. Yeah.
yeah. So we do botanical medicine. That's kind of the herbal aspect. Counseling. I sometimes have to look. There's 6, and then I'm always like, which one am I missing? We have sort of the structural adjustments, so the chiropractic style of work. So, alignment, massage, and actual like spinal and adjustments of joints in the limb. And then we do the homeopathy, which is where we kind of, we gain that familiarity with the Indian and like sort of brown culture, because everyone's familiar with that, or at least their grandparents or parents are.
Mhm.
Yeah, I don't know how many I mentioned, but that's kind of, oh, and nutrition. So there's a huge
Okay.
focus on nutrition, making sure that we're feeding ourselves sort of the world's natural medicine before we introduce anything more invasive. And then there's a traditional Asian medicine. So we do the acupuncture, cupping. So there's a lot. There's a lot in our scope. We do the similar diagnosis and sort of clinical questioning that you'd find in your medical doctor's office. And then we have so many different routes to approach it before we ever have to prescribe or take out our prescribing pad.
That's so cool. Yeah, it definitely sounds very holistic.
Yeah. Yeah.
Yeah, you kind of have a practice in all these different domains, right? And depending on, I'm assuming, like what's coming up for your patient that's coming in, you may choose to focus on one domain over another, but
Yeah. I mean, we're considered sort of the jack of all trades, which is sometimes a strength and a weakness
right.
because some naturopathic doctors will try to do it all. But I encourage, doctors that are listening to, focus in on the things that you're best at because, mastering those allows you to get patients that are the best fit. And when it comes to patients, I encourage patients to make sure that when you are seeking out a naturopathic physician, that the treatments that they provide and the diagnoses that they most typically see in their office are things that resonate with you.
Mm-hmm.
Otherwise, you might find yourself going through, treatments that may not be the
Yeah.
best for you.
Yeah, that's a really, really good point, right? That you have to kind of do your due diligence, do your research, see what fits for you.
Yeah. Yeah.
Mhm.
That's something I even tell my own patients. Like if a patient comes in and I'm like, you know what, I don't do a lot of sports med. It's in my scope. I can do it. But I think you're probably best fit with said ND, and I'll give them the reference and have them sort of reach out to another ND.
Yeah, absolutely. Yeah, I appreciate that. What are some of the most common diagnoses that you work with?
Yeah, so it's funny because I came into naturopathic medicine thinking I'm going to be a women's health doctor and that's what I want to do. And I learned very early in practice that the patients pick you. You don't really pick the patients. And so I am doing sort of a general family health sort of, family medicine sort of practice.
Okay.
But that being said, I had written, a focus on women's health. And then all of a sudden, all I saw for the first month was digestion, anxiety, depression, because that was the need and that continues to be the need. I do see a lot of women's health in sort of relation to that. If digestion and there's a stress and anxiety and all of these things are factors, then usually that results in some sort of fertility issues or, irregular menstrual cycles and things like that. So we definitely see a lot. So that's why I sort of narrowed it down to those three main focuses.
Mm.
In terms of exact diagnoses, or at least symptomology, I see a lot of heartburn, IBS,
Mm.
I see a lot of autoimmune, even though that's not sort of the patients that, again, I'm promoting my practice to.
Yeah.
But autoimmune conditions are just, it's almost becoming every fifth person that's walking through my door.
Gosh. Yeah,
Yeah.
tell me about it. Tell me about it. There's so much autoimmune, there's so much chronic stress. And, I think about what you said about if the patient picks you, and something that we kind of like to say in our field is you don't get the client that you want, you get the client that you need.
Yeah.
And I think I've definitely noticed that as a trend, even in my practice over the years. You look back and you see, okay, well, this client or this set of clients that came to me, that was really a niche that I needed to maybe hone, or a skill that I needed to hone. And that's why they were kind of given to me by the universe.
Yeah, definitely. And I have so much respect for counselors and anyone with a psych background of any sort, because I feel like while I, have that sixth element of counseling in my practice, I'll often refer out, because sometimes the emotional baggage and the load is so much that it doesn't give me, like, my whole visit is consumed by that. And I really think it warrants its own visit.
Mhm.
Uh, and I want to be able to focus on sort of the treatment aspect of things with, the herbs or the acupuncture or whatever. And sometimes there goes by like 3 visits and it's all counseling. like, at this point, this really warrants that you see another practitioner for this aspect, and I'll help with the digestion. I'll help with this because I want to make sure that my patients get the most.
Yeah,
Yeah.
definitely. Yeah, I think often you need a full health team, right? You need a number of professionals to collaborate and work on someone's
And
treatments.
and I'm loving seeing that more, like more and more integrated clinics where you're seeing an MD
Yeah.
and a counselor and RMT, and sort of this team that's there for you. And every time you step through the door, you have access to all of them. So I
Mhm.
think it's really, really exciting sort of moment in our healthcare right now.
Yeah, absolutely. Because I think we can just be working in silos, and then, your client's treatment just
Yeah.
falls into a silo too. So it's really important to have interdisciplinary connections and collaborations throughout.
Yeah, definitely.
Yeah. Um, so, you mentioned earlier, we're kind of seeing some trends with like the brown community. That makes me really curious. In your work, are you noticing any sorts of like specific trends of whether it's like symptomology or illnesses or actual diagnoses that comes to the larger brown population?
I'm definitely seeing several trends. And I think that, some of them are related to one another and some are
Mm.
distinct. But I think I'll start with our Indian wedding industry and the stress involved with that. So I don't know about Toronto, but here in Vancouver, it consumes, 4 to 5 months of our year, if not more now, since COVID. It's quite a bit. The whole year is wedding season, and what comes along with that, eating catered food for a week at a time.
Mhm.
And usually that means typically in your day, you're going to have a breakfast, lunch, and dinner. You're not going to have an appy and then some breakfast and then an appy and then some lunch and then an appy and then some dinner. And it's the amount of food you're consuming. It's the lack of quality of food that you're consuming. It's the normalizing of alcohol and redefining what social drinking is. I think that is a conversation I'm having like almost over and over, quite repetitively with patients that are around our age
Mm.
and are from the Indian community. And that's simply because we think that binge drinking, which for women is 4 drinks and for men is 5 drinks, is just social drinking.
Mm.
And 8 drinks a week is heavy drinking. That's on the verge of alcoholism. That's for women, 15 drinks being for men. That can often be one day of a wedding week.
Mm. Mhm.
And so when patients come in thinking that's not concerning and that's completely normal, and I just socially drink, I don't know why I feel so bloated. It gives me, like, I'm always like, well, did you attend any Indian weddings this summer? Are you do you have your friends over often? Does that involve alcohol? It's like, yeah, you mean I drink, I play softball twice a week and I'll have 5 drinks
Mm.
each time I play softball. And then, yeah, I had a wedding this weekend. So, of course, I drink and it's like, okay. So, even back to the basics, just knowing sometimes I'm coaching patients to just remove factors that we already know are harmful, but you just need someone to tell you.
Mm.
Um, and then there's also things like the anxiety and the pressure and the stress that comes along with keeping up, being competitive with those in the community, whether it be with the cars that you're driving, whether it be with the weddings that you're throwing, or the careers that you have. And it's great. It's great that our community as a whole is doing well. But I think that pressure and that stress is resulting in so many digestive issues, so much, I guess, dysregulation and fertility.
Mm.
I'm seeing that very directly almost through every patient visit, that this is a thing, and it's more of a community concern than it is it's not something that's taught in a textbook, that the Indian party world causes concerns directly to your stress, your digestion,
Yeah.
your regulation.
Yeah,
Yeah.
I really like that. I like how you kind of contextualize it as a community, right, issue that is like really like perpetuating right now. And I think that really makes me think too about how, yeah, like you said, a lot of this is normalized. It's really normalized to go out and party. And, you know, our wedding events are like 7 events in 1 week and not really pay much mind to what you're consuming in terms of food and alcohol. And then also this lack of I think understanding on how what you're consuming is impacting your system.
Yes. And then those who are saying, I didn't really want to drink. I, stuck to energy drinks and Red Bulls, or sorry, energy drinks and bubblies.
Mm.
Okay, but that is a carbonated beverage, and the energy drink is highly caffeinated. So all of this stuff is destructive to your digestion. And so ultimately, if you're not mostly consuming water, then you're gonna feel the impact of that. And
Mm.
that kind of thing, like bubbly, I have patients who will only exclusively drink, I'm not talking about like, I'm talking about like the canned bubbly.
Yeah.
And I have, again, that's like a new problem that I didn't even know until I was in practice, that people consume this as their only beverage.
Yeah, yeah, I've heard of that too.
And they're having, issues being able to go to the bathroom, and it'll be every like 3 times a week, or, once a week, because, and then I go back to the diet, back to the basics in my questioning. And it's like, oh, I just had like, I don't know, like 9 to 10 bubblies a day. I'm like, the soda stream being so
Yeah.
popular as well. It's made, every time there's a new gimmick or a new sort of tool, all of a sudden everyone has some kind of health decline.
Yeah. So out of curiosity, how do carbonated drinks, so like bubbly, how do they impact the
Yeah,
digestive
it
system?
disrupt your digestive lining. It causes inflammation directly into your um, sort of the small intestine, large intestine, even the stomach. It's causing inflammation, so it narrows the passageway, and thus, induces, not for everyone, but you'll see a lot of constipation, bloating, because there's that inflammation in the lining, heartburn, and it's just along the whole way. And if all you're having is carbonation, um, you're going to see a lot of inflammation increase.
Oh, interesting. Is
Yeah.
there a safe number of carbonated drinks that someone can have a
I
day?
would treat a carbonated drink like I would treat a juice or something, it's a treat. It's not necessarily a daily intake. 2 or 3 a week, I wouldn't be concerned about. But if I'm hearing that your only sort of hydration method is drinking bubblies, that's concerning for sure.
Yeah, absolutely. You
Yeah.
know, I think about how if someone who's maybe say like struggling with like their alcohol use, they find it easier to abstain from alcohol by using like bubbly. And then I think about how that's also very disadvantageous for your system. Like it's still not a good replacement.
Yeah. I
And
mean,
then,
most replacements usually aren't. If someone's saying, "Oh, I'm going to go gluten free," a lot of the gluten free foods end up being, um, not great for you. Or like, the if you're a vegetarian and you want to buy like mock meats, a lot of those have a lot of additives. So it's just about going back to those whole foods, and that's what I always recommend. If you can grow it, and can buy it from one of those farm markets, then you should eat it. If
mm,
it's packaged, if it can sit on your shelf for months at a time, probably not the food for you. If it's a freezer food that you cannot really identify what's in it, and it's just like packaged into some kind of patty, probably not the best for you. Going back to like the chicken, and like chicken breast whole, versus having sort of the breaded
oh, but it
meat.
tastes so
I know,
good.
we cook it at home.
Yeah, yeah, you're right. Yeah, no, absolutely get the panko breadcrumbs.
Yeah.
But I think, yeah, you're absolutely right that whenever there's some sort of a trend,
Yeah.
in the food industry, it definitely impacts our digestive health, even just like our general like lifestyle, because you become so all consumed by it, right? Like bubbly's one, LaCroix, like I'm seeing people in my personal life who just have their fridges like stocked completely with these
And
carbon.
it's aesthetically pleasing too, you know, like the rows of all of the traumatic, you know, food for your digestive system. And it just, you know, we're in that era of organization and replacement of, you know, healthy replacements for things, but we don't look at the ingredients. We trust that no GMO, or like we trust that one statement on the box, but we're not looking at all the other things in it.
Mhm. Yeah, absolutely. So that's definitely, I think, one really interesting trend that I didn't expect come up. Are there any other trends that you're noticing in the brown community?
I mean, like India, so not including, not simply just North American, you know, brown population, but India, and I'm sure, you know, similar trends in Pakistan and things like that. But India is responsible for 60% of the world's heart problem burden. So heart conditions in general.
Mm.
And given that the world has many, many, many other ethnicities and lots of people, to think that that one country is responsible for 60% of heart conditions, it kind of speaks
Wow.
to me about the way that we conduct our diet. Like, you know, that we're eating our ras malai, we're having our gulab jamun, we're having all of these foods.
Yeah.
And eating, I think, Indian food at home usually is okay if we're making it from scratch. You know, you can make lentils, you can make dal, right? And you can make a lot of the sabjis with, in a way that's very healthy. But most people that can't cook Indian food themselves, being our generation, are having butter chicken takeout or shahi paneer takeout, or like the butteriest dal you can ever get, like from the local Indian restaurant. And so a lot of that is definitely going to contribute to the trends in North America for sure.
Mm. Yeah, definitely. Wow, 60%. That is.
And I mean, that's, India does have a, like, of course, like huge population, but that being said, that's one community basically, you know, Indians,
Yeah.
50% of heart disease burden for sure.
Oof. Yeah, that's a huge number. Um, I am noticing just in like my work, I'm noticing a lot of PCOS and hormone disturbances with that come with anxiety in brown women. And I'm curious if you've seen this relationship, and what does like naturopathic medicine say about this relationship?
Yeah, so I definitely do see a lot of PCOS. And that's in, I would say, in all communities, but of course we have our own, you know, set of stressors, whether that be, um, I don't know, if you're married and you're living with your in-laws, and that's an adjustment, but or you are having the pressures of schooling where you're only allowed to be a doctor or a lawyer and nothing in between, or, you know, all of these pressures that come for our own household and the expectations embedded within it. It's nice to see that changing and people having these creative careers and having sort of different ways and methods of generating income. But I will say that the stress almost is the underlying cause for a lot of the things that people come in with, whether that's relationship issues, dealing with things like the stigma of divorce, and that's not accepted in our community. So people are sticking to unhealthy relationships. And often the first thing that they'll say sitting down is, you know, I have this, this, and this. Like you know, I'm coming in for constipation. I'm coming in for, I like PMS. But then when we get into the questioning, and that's something I love about my career, is that I have that 1 hour with my patient, and I get to really have a thorough health history. By the end of that hour, they'll say things like, yeah, I've been in a 13 or 15-year relationship with my partner, and it has been highly stressful, but now his parents know, and now my parents know, and I there's no way out.
Mm.
Or, you know, I'm in an abusive relationship, but divorce is not something that is an option. So when I'm hearing things like that, and we're seeing trends like clotting and painful periods and intense back pain and debilitating symptoms, you know, in relation to the cycle, that's definitely very telling of, to me, that this whole thing is really only a stress picture. And so for those that don't know, basically your body only has enough energy, like actual physical chemical energy, the ATP, to allot in the production, like a certain amount of energy to produce each hormone. But if your stress is up here and you're having to match that with cortisol, and the management of stress, cortisol being our stress hormone, then every other hormone sort of it's like a domino effect. It also is impacted. So whether that be your hunger cues, the leptin and the ghrelin, those digestive cues, or any of those digestive enzymes. So now all of a sudden you're having issues there. You might have bloating, you may have heartburn, you might have like other symptoms regarding the digestive system. Or you might have issues with your estrogen, progesterone, and all of these women's hormones, and now your cycle is off. So things like that, I think managing that stress. And then some people will get the blood work back and say, you know what, my cortisol is actually low. It's not high. You told me it was high. And that's when that point of adrenal fatigue comes in, right? You have depleted your resources of cortisol and management of stress. And now not only do you not make enough of that, your body's so fatigued, you're not even making enough to combat a minimal level of stress. And so this definitely causes issues with insulin, another hormone. And often people hear insulin in relation to things like diabetes, something that gets tested, and its abilities to sort of help manage sugar levels and blood sugar levels. That is a direct sort of relation to PCOS, polycystic ovarian syndrome, right? And so all of that, so basically eventually if you're releasing hormones like adrenaline and cortisol in such extremes, then the insulin isn't regulated, and thus you have insulin resistance. It's not necessarily going to be responding the way that it should. And so you see things like PCOS, which is, it's debilitating in its own way. You have fertility issues, you have cold intolerance, you might have hair loss. The hair loss may cause further stress because now you're feeling like there's body image issues, and the destruction continues. So I think we need to normalize, especially in our community, for men and women, talking about stress and being having that stress be validated. You're allowed to have normal stresses in life. And I think that need to just sort of brush it under the rug and appear happy and go to these social events and, still play your role as father or mother or daughter-in-law. It's that upkeep of appearances, I think, is something we need. I don't know. We just need to start to abolish that a little bit.
Yeah, absolutely. No, I really love that, because I think this is something that most of us don't unfortunately understand, is that the mind and body are connected, right? What's happening up here is impacting your body. And for those listening who would like to learn a little bit more about this, I'll link a couple of episodes that I've done previously explaining this, but the mind and the body are absolutely connected, and everything just seems to go back to stress, doesn't it?
Yeah.
And there's been a lot of research done too, where they found 5 personality characteristics that are actually tied with developing chronic illnesses. So you've got like chronic and extreme suppression of anger.
Wow.
Got like people-pleasing tendencies. They're tied to development of chronic illnesses, especially ALS. So it's like you have now so much research that's telling us that it's not just enough to work out and eat right. We need to take care of our mental health as well.
Yeah. And stress, you mentioning that just now, stress causes inflammation. Thus you're seeing all of these autoimmune conditions, and you're seeing life things triggered for like a lifelong sort of trajectory. And you may as well sort of stop that right now in its tracks and focus on your well-being. And rest and relaxation means different things to different people. Some people will force themselves to stay in one night rather than go out and sit on the couch and say, this is my relaxation, but I'm still not getting better. But maybe that's not what it means for your body. Maybe it means that you need a walk and you need to connect with nature. Maybe that means you actually need more time with your family. So whatever you feel that brings those stress levels down is different. It's so individualistic, and that's sort of the nature of naturopathic medicine, is figuring out what that means to you. And so for some patients, I'll give them 4 supplements, and I'll give them an exercise regime, and I'll give them all of these things. And for another patient, I will just call them in for acupuncture, because I know that their ability to stay compliant due to their stressors is very low. And so at least I can watch the treatment in the visit, because sending someone home with supplements, if they're not going to take it, it's no use, right?
Yeah, that's a good point. And obviously there's no cookie cutter, treatment kind of approach for everyone. But out of curiosity, what types of hormones, or what would somebody with PCOS and anxiety, what would their sort of treatment plan look like?
Yeah, so there's actually, like, of course I can't give doses and stuff because it depends on who I'm dealing with, and it might vary what I'm giving someone based on allergies and sort of that kind of thing. So there's your disclaimer.
Yeah, absolutely.
But I definitely start with foods. So looking at sugar intake, looking at sort of the vegetable fiber intake. Fiber is huge in reducing insulin resistance, so something like that. So our sort of management techniques are definitely going to be lowering testosterone, reducing estrogen, like the bad estrogens, which is what you'll hear, lowering cortisol. So that means maybe some adrenal support, so an adrenal supplement. For those that don't know what adrenal glands are, they're little glands that sit on top of your kidneys. They are also responsible for releasing cortisol. So making sure that they're not fatigued, they have not been, having to overcompensate for the mismanagement of stress. So there's definitely things like ashwagandha and L-theanine, and there's just so many supplements that help sort of that mechanism. There's lemon balm. So one thing I don't typically do is hand out a multivitamin. And I think a lot of patients, when they come in, are on a multivitamin. They're like, but I'm taking my multivitamin. Why am I not okay? And I don't necessarily do that, because there's not really a high enough dose of anything in it. So you'll see all of these things, and you're like, I'm getting my vitamin C and I'm getting my B vitamins, and this is great. I'm getting it all in one pill. But maybe you don't need some of those things. And then on top of that, none of them are going to be an actual therapeutic dose for you. At least they're likely not going to be.
That's a good point. Yeah.
Yeah. And that's something we're so good at going to Costco and seeing which supplements on sale and putting that in our cart. But even the quality of supplements matters, right? We want to make sure that we're getting medical grade supplements, which with fewer fillers and additives. So the more ingredients you see on your supplement, that's like Weber's Natural or any one of those drugstore brands, that they have the cheapest version of the supplement. So the form, because they come in different forms as well. There's so many fillers decreasing the absorption in your digestive tract. So when you see only like 1 to 4 ingredients, that usually is an indication that it's a higher quality supplement. You're more likely going to absorb it, and you think, oh, but those are cheaper, I'm wasting money. However, are you not wasting money if it's going through your system and, out?
Yeah, absolutely. That's a really good point with the multivitamins, because you're right. We have like our multivitamin gummies, and we're just like, oh, I'm just going to take like 2 of these every day and I'm going to be super healthy. But it's maybe not what your system needs, or maybe not the right amount of what your system needs.
And even with the PCOS, like a lot of it is regulating the cycle. And so there's things like Vitex. B vitamins will be good. There's so Vitex aegus is chase tree berry, which is a herb, and it's really good at making sure that your estrogen progesterone spikes are in the right part of the cycle, and so that helps regulate a little bit. NAC, inositol. So there's like definitely a lot I do, which is why I'll list it all to you, but that doesn't mean you need to take it all. It'll kind of be dependent on what the patient's coming in with specifically. And acupuncture is great for stress. Even within the visit, you see someone really walk out a little bit more fresh, a little bit more ready to take on their day. Yeah.
Yeah, I think yeah, it's a combination of a number of things, right? Because there's definitely like a relationship between overthinking with the anxiety and the catastrophizing and presence of a dysregulated menstrual cycle, or just like, endometriosis where you're just like constantly just like bleeding, 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 and then you're not bleeding for like months at end. So it's just this really severe dysregulation does impact the mood.
Yeah.
Absolutely does impact stress levels. It does impact worry. So this is something that when in my work with clients as well, I kind of recommend them, okay, we need to have you see like a naturopath, or we at least have you see your doctor to talk about what is going on with your cycle, because this is not normal for the body.
And I think that is, being someone who hasn't personally had any kind of irregularities in my cycle throughout, that is my normal.
Yeah.
But some people come in thinking that clotting and mood swings and debilitating cramping, oh,
Mm.
that's just PMS. Everyone gets it. That's normal. PMS is actually a condition that requires treatment. That's not actually something that should be normalized. And I think we do as a society normalize it. Oh, she's just on her period. But that actually, I actually have a set of tools to help fix that, you know? And nobody, I have patients, and I think my most recent one that I, over the past few months I saw, she's like, I clot the size of a tennis ball almost every period. And that to her was her normals, because since the
Yeah.
day she started menstruating, that was what she saw. And why would you think that's not normal if that's the only version you've ever seen? And so normalizing these conversations and having that information out there, and having there be somewhat of a preteen wellness check with, with women, just like we do sort of those children's wellness checks, just to let them know that, hey, watch out for these things. And if this happens to you, then come back and seek treatment. And even just educating parents about that, because that would relieve so many fertility issues, and putting sort of setting that straight before it becomes an issue for you in the future.
Yeah, 100%. I think there just isn't any education around this, at least when you and I were growing up. I remember like in the 90s, like there was barely any education about menstrual cycle. So who was there to tell you that you shouldn't be clotting, or this shouldn't be happening, or if you have debilitating pain, then that's abnormal? That narrative just didn't exist. Now I think we have a little bit more information thanks to apps like Flow and whatnot, but I think
Yeah.
it's still not enough.
No, it's definitely not enough. And it's also just a taboo topic,
Yeah.
especially in our community. I think that's something that's specific to the brown community, where we don't really have discussions in the Indian household about our menstrual cycle and irregularities that we're feeling, or irregular cramping. Maybe it's not the whole abdomen, maybe it's the left side. That could be the ovary, that could be cyst formation and the bursting of the cyst, right? But that's not something we're like, okay, it's just your period, like that's fine, it'll pass in a few days.
Mm.
If you're checking that out early enough, maybe you're not having more severe symptoms later on.
Mm, yeah, 100%. Oh, it's all so fascinating. Um, Actually
Yeah.
makes me curious. You mentioned L-theanine earlier. So, these types of like supplements are all the rage right now. Like I'm hearing everybody just like take magnesium, everybody's taking collagen, and now I've started hearing about L-theanine. I don't exactly know I don't know much of what it does, but I'm really curious about these. Like, is there a universal need for these, or do you think a lot of them are just like part of this fad and people need to be really careful about what they're taking before they take it?
Yeah, I think there's this world of self-diagnosing, and because there's information out there, internet being fantastic and allowing people to catch things based on putting their symptoms in if they're concerned, and being able to do their own research, it is such a great resource. But at the same time, you need a medical professional leading you through your journey, because I'll have patients coming in with I think in like insomnia being one of those things, or depression, where they have tried so many different things just based off the internet, and they continue to layer those things. So they'll take supplement A and B and C, and they're like, oh, but none of it's working. But they're overloading their body with multiple things, not at the right doses. And the recommendation of someone who wrote it on the internet, it might not even be a dose that is safe for you to take. You haven't looked at your coexisting sort of comorbidities or like the conditions that you have. So are you hypothyroid? Even when it comes to anxiety and stress and depression, I'm not so quick to label and say this is a mental health diagnosis you have. You have to look at your thyroid hormones. You have to look at your ferritin and your iron and see, is this a presentation of low iron, or is this a presentation of a mental health concern? Is this a presentation of hypothyroidism or hyperthyroidism, or is this a mental health concern? A lot of fatigue is mistaken for mental health stuff. So if you're someone who's like, oh yeah, I'm really fatigued, so I'm going to start taking iron because everyone else does, your ferritin levels and iron might be completely optimal, and now you're overloading your body with ferritin, with iron, and that was never the reason for your fatigue. This is where a medical professional comes in. Just because it's over, or not even over the counter, it's just sitting there on the shelf for you to grab, or online for you to put in your cart, does not mean you should be taking it.
Yeah.
And so maybe you require some thyroid support, or maybe you have low B12, and so your energy production is not optimal. So there's just so many reasons for every symptom you're feeling. It's not fatigue means more iron, or because I'm working out I must take protein. Maybe you're consuming enough protein through your diet, which a lot of people aren't, but even just recognizing that those whole food sources of protein are what you're looking for. Throwing a protein powder, while beneficial if you have some severe deficiencies, isn't necessary for you, maybe.
Folks, before you take anything, go to a naturopathic doctor.
Yeah, and I think the whole everybody eat kale now, everyone have your turmeric milk, and it's this trend, and it doesn't suit everyone.
Yeah.
And again, like having a little bit of turmeric in your milk isn't a dose that's going to help you with your autoimmune condition for the inflammation. You're going to need a concentrated sort of capsule with the right form of the supplement that's within the turmeric, right? To be able to, the curcumin is what you actually want, which you're not going to get in the dose that you need. So things like that, it's like I wish that every patient that's putting that much effort into their health, because it comes from a good place, would have the right guidance so that they can exert that energy towards something that is going to help them to the degree that it should help them.
Yeah. And it just really breaks my heart that naturopathic services are not, well, in Ontario, they're not covered, but yeah, they're not covered by like our healthcare system. And I think that just speaks like the bureaucracy that exists within the healthcare system. But clearly there's such a need for a holistic practitioner.
Yes, definitely. And I know you asked me earlier about like NDs versus MDs, which again, every practitioner has a place. I think another thing is a lot of people will come in with labs and they're like, my MD said my labs are fine. Yes, they're in the optimal, not in the optimal range. They're in the range of normal. But sometimes if you look at those values, it's like 15 to 243. Where in there is actually optimal for us? So you're not too low, too high based on this range that you've been given. But does this mean you're functioning optimally? Probably not. So when I read lab work, and given that I have more time and maybe a greater responsibility towards my patient with that time that I have with my patient, I'm definitely looking to make sure that even though you weren't flagged for a thyroid concern, your thyroid hormones are being produced not adequately, but optimally, So that's something that's different. So I always encourage anyone going into their ND to take their most recent blood work with them. Again, like if I write you up a lab requisition, it's not going to be something that's covered. You're gonna have to pay out of pocket, and that makes people hesitant. But I think it's important to have that information so that I can best guide you.
Absolutely.
Yeah, and at the end of the day, I just want to see those results. So if it's not through me, like you're welcome to add other practitioners to that healthcare initiative. But to put things into perspective, an MD has 2,600 hours of academic time. So it's 2,600 hours. An ND has 3,348. So we actually have quite a few more academic hours than an MD has. So when we are getting more in depth with a lot of those supplements, we're in depth with a lot more of those optimal levels, it's because we've just had that time and training to be able to focus on not necessarily encouraging survival, but encouraging wellness.
Absolutely.
I mean, MDs do have 2,200 clinical hours. We have 1,400, but that discrepancy is not because we're seeing, patients less. Like it's not from our one-on-one patient sort of experience that discrepancy is due to the fact that we don't offer major surgery and the MDs are trained in major surgery. So, that's not really a huge discrepancy given that there's the whole element of surgery there. So I think to know that, the 4 years of medical school and 4-year undergrad in science with like specific prereqs is not something people know about naturopathic physicians. They think that it's more so, they did, maybe a year course or something and studied some herbs and now they're about like candy. Like that's not necessarily what we do.
Okay. Yeah, that's good to know. When and it's one of the last things I'm kind of wondering about when it comes to like the brown folks that you've worked with, are you noticing more openness from them in accessing like naturopathic services? Because I know there can be just a general mistrust maybe sometimes of like Western medical solutions, or maybe this like over like sense of like submission, like, what my doctor says, so I'll do whatever I want, whatever they want kind of thing. So I'm just wondering, what kind of attitudes have you noticed with people coming in for naturopathic support?
So I have like a few different kinds of patients. My first kind of patient is I've tried everything under the sun and I need help and I'm going to come to you because I tried everything in the medical world. So that's sort of the patient that comes from desperation. Then I have the patient that comes in saying, yeah, like my mom kind of does naturopathic medicine. I don't really believe that it's going to work for me, but I'll come and give it a shot. Like, here's your shot. So that's my very sort of that patient that is testing me, it's more so like, here's your chance. If you blow it, then I'm out. That always makes me laugh. And then I get the person who is very much, this is what I believe. I want to heal my body naturally, and I don't want to bring in extra things unless I have to. And I think the benefit of being from the Indian community or the brown community is that it's embedded in our culture. That's what we've grown up with, and it's not new to us. It's what we trust, right? And so when it comes to, I actually have like a list of just like normal things that we do that are naturopathic remedies. So things like nimbu pani, people drinking lemon water, that is something that I would recommend to a patient for a detox to help with weight loss, digestion. It's an antioxidant. It's called helps improve the collagen production of your skin. But that's something we just do. Or like having turmeric in all of our food and having healthy stains on our counters, like that stems from somewhere, and those anti-inflammatory properties. We know we're making food that might be a little fatty, so we're trying to add some benefit into it with all these herbs and spices. Even down to our cha that we drink, right? Or chai. It has we'll throw in like the cardamom and the clove and the ginger, and all of these have great digestive, anti-cancer properties, as well as preventing blood clots. We probably know that we have the most heart episodes, so we're trying to build that into our diet. So a lot of my Indian patients are very trusting of the medicine, and it makes sense to them, and I think that's more a cultural thing.
Yeah, yeah, absolutely. With like such strong roots in like Ayurveda, I can see that a lot of brown folks being from the older generation being like a lot more open and trusting, and the newer generation being a little bit
It's always like their children come in and they're like, well, give it a shot. Like,
yeah, exactly.
I already drink my celery juice, but let's see what you have for me.
Yeah, I can just take like L-theanine over the counter.
Yeah.
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 Oh, yeah, it's really interesting, isn't it? How things change with generations, and now maybe with this next generation, they're going to be a little bit more conscious of what they're putting into their body. It always comes in waves.
Yeah. Yeah, definitely. No,
Yeah.
I think it's just so important to understand that whatever you're putting in your body is going to fuel your ability to combat the world, right? So if you're low on energy and you're just loading up on coffee, then you're gonna get out of it what you're putting in,
Yeah.
you know. But if you're taking things like rosemary, whether it's food or a tea to increase the circulation to your brain, and you're taking like things like CoQ10, which is coenzyme 10, something built to help promote the production of energy. Now you are fueling your body and reminding your body on how to function optimally, and you won't get that coffee crash, So the effort you're putting into your body is what you're going to get out of it.
Yeah, I like that. I like that. Yeah. Oh, on that note, I am just being mindful of our time, but this was so informative. I had a really nice time talking to you.
I did too. Thank you. It's such a pleasure.
Yeah, absolutely. And I mean, I know we can kind of go on and on and on about this. We basically just scratched the surface a little bit today. So I'm going to ask everyone who's listening, whether you're on Spotify or you're on YouTube, there's a little Q&A section on Spotify at the bottom. If you have any specific questions for us, please feel free to ask. And of course, on YouTube, the comment section is there for your using. Let us know if there's any specific things that you're wondering about. Obviously, Ekum's not here to give any medical advice or any specific like treatment advice, and we know that there's a disclaimer at the end, but if there's anything general that you're curious about, let us know and we would be happy to do a part 2.
Yeah, I would love to have you invite me back.
Yeah, absolutely. Well, thanks so much for joining me today, and thanks so much for listening, everyone. If you want to check out more of Ekum, I will have all of her links, socials, website, all of that down below. And if you're in BC and you're looking for a new naturopathic doctor, feel free to connect with her. She's lovely. And please stay tuned for our disclaimer. The guest and the host at Brown People Problems do not offer individualized therapeutic or medical advice, and our conversations should not be interpreted as such. This podcast is not a replacement for therapy. This podcast exists for educational purposes only. Please consider your circumstances and engage with the content mindfully.